Okay. And I just wanted to say thank you to Anil, to Emer, to the entire Cancer Center. Under Anil's leadership, the CONE office has really expanded thanks to institutional support and all of his leadership and Emer's leadership. So I want to thank them. I want to thank the entire COE team. Kim Burke, who's the operations manager, is on the call, and I think a number of other key people of COE will be joining. So when we have the question and answer period, I can introduce them as well. I'll have to ask you, Emer, who's on. But I was going to give a brief overview of our COE office, and then we can use the rest of the time to hear from you and answer questions you may have on your research and how we can help you in terms of community work you may want to do in your research, and give you an overview of what we do and our services. Okay, feel free just to interrupt throughout this presentation. It'll be fairly informal, and we can make these slides. Emer, I can share these slides with you.
Great, thank you.
Okay. Okay, just very briefly, our COE office has 4 interrelated aims. They include monitoring the cancer burden in our catchment area. I'll very briefly give you an overview of that. Outreach to our local communities throughout our catchment area. Research, and that means helping all of you, promoting and facilitating community relevant research within our catchment area. And then engagement with the broader catchment area communities. This includes working at the city level, the state level. We have a consortium now within New York City of the different cancer centers who do community outreach and engagement. And I'll tell you a little bit about that at the end, because we've all been organizing a major event for the first week of June on tobacco. Health fairs, but also from the very beginning, we've had a small office that's been dedicated to providing translation services and other kinds of services to help researchers do community work. So that's been going on, but again, under Anil's leadership, it's really involved to a much larger team. And as well, our catchment area has evolved from a primary geographic area of Washington Heights, Inwood, and the South Bronx to a much broader catchment area that really reflects where the HICCC cancer patients come from, which include all 5 boroughs, New York counties of Westchester and Rockland, and New Jersey County of Bergen County. We also have a community advisory board, and I'll describe briefly our advisors there because they may be relevant and help you for your own research as well. We also partner with offices across the medical campus, including the CTSA. And so again, now we've evolved to really focus on these 4 interrelated aims that include monitoring our cancer burden, outreach and educational workshops that we do within the community, making research relevant to the community, and broader engagement. So this gives us just a quick overview of our community advisory board. Again, we're really very privileged to work with all of them. They include people who are patient advocates, people who have led the way in environmental justice in our community, people who also do patient navigation. It includes medical doctors, former NYPD officer who does a lot of outreach on cervical cancer. And so as well as we have board members from the Staten Island government office, which also helps us for broader outreach as well. So you can see we have a number of very active community advisors. Very briefly, just to give you an overview of our catchment area, as I mentioned, up until the last year, we primarily focused a lot of our community outreach area most closely in proximity to the HICCC. The demographics of our catchment area are incredibly diverse, including about 63% non-white, 35% foreign-born, and about 17.5% below the federal poverty line. When you look more locally at the immediate neighborhoods around HICCC, which include, again, Washington Heights, Inwood, the South Bronx, and Central Harlem, you'll see it also is a very diverse area. As a result, there's great opportunity, because we've had a lot of successes more locally with HPV vaccination uptake being very high, screening services also being very high. One of the assistant directors of COE is Karen Schmidt, who runs the Cancer Center screening services and the Avon Screening Center. And again, what we're planning to do now is to extend some of the successes we've had locally across the greater 8-county catchment area range. So just very briefly to give you an overview, the greatest cancer health disparities within that 8-county area include mortality differences in breast cancer in areas like Washington Heights and South Bronx, where the incidence is actually lower, but the mortality is much higher. Also, prostate cancer incidence, these vertical bars are the US. Prostate cancer incidence is high across the catchment area, but the mortality is really much higher in these areas of Bronx, specifically the South Bronx, close again to our campus, and also Washington Heights, Inwood, and then also liver cancer incidence and mortality. COE has helped with, again, through our aim of monitoring with making the Cancer Center more aware of these greater disparities. We also do a lot with breast cancer in terms of, as I mentioned, the Avon screening with Karen Schmidt's leadership, as well as a lot of educational activities. We also have been working a lot with our community advisors in Central Harlem to expand a lot of our outreach specific to prostate cancer awareness, and working with local leaders on that. And again, as you may be aware of, the HICCC, again, under Neil's leadership, has really focused a lot on expanding basic science and clinical translational work in understanding these liver cancer disparities. So again, very briefly, what we do is we do outreach. So that includes working in the communities to tell them about the HPV vaccination, hepatitis vaccination programs, tobacco cessation programs. You'll hear in a few minutes from Kim, who's designed with our whole COE team and partnering with the rest of the cancer centers across New York City this whole week of tobacco cessation online events. We also do educational workshops. Again, my partners with all of this is Karen Schmidt and Grace Hillier. Grace specifically focuses a lot on tobacco research as well as clinical trials outreach. We also do a lot of outreach regarding screening, treatment for cancer, and also survivorship programs. One of our key health educators, senior health educators, is Andrea Reyes, who's been working in the community for well over a decade, doing Spanish and English community workshops. And again, our community partners help us design a lot of these workshops. So what is helpful, and thrilled that you all joined the call today. What we specifically wanted to tell you about today is what we can do to help you with promoting and facilitating research. So we're happy also if we can help you design community education events that you want to do, but specific to your research program, we have staff here. As you can see, this is our entire team here. I had already mentioned Kim as well as Andrea and Karen and Grace, but we have Kazim, who's been with the Cancer Center for over 15 years, Anushka, who just joined this past year, Maya, who's a health communications specialist, Megan, who is a data analyst, and then we have faculty and staff who interrelate with us specifically for specific projects and expertise. We have Jasmine McDonald, who focuses on cancer health disparities, as well as Parisa Taranifer, who also does mixed methods. Melissa Stockwell does a lot with HPV and digital technology. Sydney Hankinson, who focuses his research on mental health, but also has interacted with us in because he runs a community health educator program for Columbia, and we work with him on that. So we have a group of faculty and staff who want to help you with your study. So specifically, we may be helpful to you if you're starting to develop a pilot study. We can also help you again with conducting that study. After you get the grant, we can help you doing surveys and working with the community advisory board. And again, the extent of services is wide, so it does depend on sort of what level of interaction you need. So again, we've done a lot of workshops, including workshops and high school curriculums. We've done workshops in English and Spanish, and webinars on HPV. So again, now because we're working remotely, most of these webinars are all online. We do health fairs, and we'll again, but right now we're doing all of our interaction online. We're even doing qualitative and quantitative work online, so it can help you with that as well. As I mentioned, we're involved with the city as well as the state. So the city, we've been organizing all of the cancer centers within New York City. Our community outreach and engagement offices work together to plan citywide events. Again, we're doing a tobacco one very shortly. I'll have Kim tell you a little bit more about that. And we also are involved with the New York State Cancer Consortium. So if you're not aware of either of those two consortium and you want some more information, feel free during the question and answer period. I can tell you how to get involved in those, and or you can email me or any one of the COE people after this. So again, what we do is we do these educational workshops. We also monitor the cancer burden. So if you need to, for example, know about specific community profiles, if you want to work in a specific community and you want to know their prostate cancer rates or any of that, you can just contact us, and we're happy to do any descriptive analyses with the data sets that we have for you. We also work with our community partners to create projects that address these cancer health disparities, again, with three of the biggest being cancer mortality differences in breast, prostate, and liver cancer. And again, we do all of this through a number of different events. We had our own team for Velocity last fall. We've organized coat drives. Now, with Anil's leadership, we're working on starting other kinds of fundraisers that we can do to help our community partners right now, particularly with food banks. And we work a lot in our high schools and other community programs. So what I thought would be helpful then is for Kim maybe now to just kind of go through, if I can pass it to you, Kim, with some of the specific kinds of things that COE staff do. And then during the question and answer period, if there's other COE members that are on this call, we can also answer specific questions. So can I pass it to you now, Kim? Or?
Sure, yeah. Hi, thank you. Thank you, Mary Beth. So yeah, our staff and our team have been helping investigators at the Cancer Center since we've existed, and a lot of the work that has been done has been around translations, translating documents into Spanish, helping with interviews like qualitative research, so individual interviews, facilitating focus groups, helping with surveys, helping to disseminate surveys, and also providing feedback and guidance to sort of tailor the language of materials that are community facing as well. So our team has a lot of experience with adapting materials to specific populations, literacy, and in terms of cultural appropriateness. Let's see, we also can help with IRB submissions and literature reviews, all of our kind of different activities are listed here. Recently, our senior health educator, Andrea Reyes, has been involved with a project on liver cancer, and she's translated the interview guide. She'll be conducting qualitative interviews with patients over the phone. So that's just kind of one example of a recent project. But yeah, we're very open to kind of talking with you about your project and figuring out how we can assist with your specific needs.
Great. Should I do the next slide or?
Sure.
Okay.
And then some of the workshops here, these are kind of the main workshops that Andrea, our health educator, and our team's been doing in the community. We have workshops on how people can generally lower their cancer risk through different behavioral and screening activities. Breast cancer is a big focus. Prostate is being developed right now. Also, we have a workshop on colorectal cancer, tobacco, and all the tobacco products that are in use. HPV and cancer, skin cancer, breast cancer and the environment, cancer genetics, and we have a workshop on cancer risk reduction for high school students. That's also been taught in Northern Manhattan, the Bronx, and Staten Island. So those are some of the cancer types that we cover now. We're also, with the liver project I mentioned, we'll also be developing a workshop on liver cancer. We're open to developing new workshops based on, your research too, because part of what we're doing is trying to share some of the basic info with community groups, but also to bring, if there are new findings that are relevant to the community, to help share that as well. So we usually do these workshops through networking with people on our community advisory board and through relationships with different community organizations. So, in the past, we would go to a site where they had a group of people organized, and we would go and teach the workshop in English or Spanish. Now we are starting to explore how to do these online. We have been doing more webinars, and that's been very successful. So we would also be available to help if there was a webinar that you wanted to do in the future that you think would be of interest to a certain community. We would be happy to assist you with setting that up and doing that as well.
Yeah, I mean, that's a great point, because we had Kim and Anushka on our team set up a webinar just last week or the week before, where they were interested in environmental chemicals and breast cancer risk, and they set it up with one of our community partners, and 77 people joined the webinar. So we can help. If you want to do a community talk, we can help circulate it with our community partners. And as Kim mentioned, we can do that for you while we're all working remotely, if there is something that you'd like us to help you on. Okay, great. I think we showed some of these pictures already.
Yeah, I think we showed that.
Okay. So maybe then I'll go just to the let's see, we talked about that. Just then maybe we can do the question and answers. Also, just to let everyone know, we can send, Emer, if we send these to you, or could it circulate to the people that are on the call, or we could actually put this link in the chat. Kim, if you want to put this link in the chat.
Mm-hmm.
Oh, sure. Mm-hmm.
Yeah. So now we have, if you need to reach us, we have a page obviously on the HICCC website, and it will talk more about what we've just reviewed very briefly here. But again, feel free to reach out anytime to our COE email, but also you can email me directly, or if you email Maria or Emer, or they can send it to me, but feel free to email me directly if you want to just talk through any of these ideas that you might have to work in our community.
Thanks, Maribeth. Yeah, we'll make the slides available. We're also recording, and we'll make this webinar available to people on our YouTube channel. So if people have questions, if they want to unmute themselves or pop their questions into the chat box, please feel free to do so. Mary Beth, I could start, Mary Beth and Kim, asking you where you think the greatest opportunities are for basic researchers as they're addressing a question in any given cancer, and in order to connect that into the community and into what our community are seeking from us and what we can give back to the community, particularly from the viewpoint of, let's say, a basic researcher who's addressing some question in their lab in a particular cancer.
Yeah, that's a great question. And I mean, I think we're happy to help facilitate any basic researcher along a whole variety of ways. So one might be if they're interested in looking more at the data for the outcome that they're studying specifically and how it varies, you know, by neighborhood within the 5 boroughs. Again, given the breadth of New York City, there's so many contrasts, as everyone knows, you know, at every kind of demographic level. So it really is kind of epidemiologically a really rich area to conduct research. We also can connect you with you know, members of the School of Public Health like myself who have these long-standing community cohorts where we've collected biospecimens and including tumor tissue, blood, and urine, and so you know, could work with you and you know, if you want to address any kind of basic science question using any of those existing samples. We also would like to help in any way, and I've spoken to Wendy Chung, and she's very supportive of this, in partnering with her Office of Education. So between the COE and her, Wendy Chung is the Associate Director for Education of HICCC, and actually work together to have a training program that we hope to launch this fall to help basic scientists as well as you know, other clinical scientists and population scientists, but particularly basic scientists who want to give talks in the community. We were hoping to do a training program to help because their research is so relevant to the community. But I think it does, you know, it takes kind of a two-way communication, and we're working developing some tools to, you know, to do broader education within our community partners and stakeholders on key concepts like epigenomics and things like that. Already we had a supplement, Grace Hillier, who has a doctorate in health education, designed a program in precision genomics, and that's been tested, you know, in over 500 people within our community. So we're happy to engage on a variety of different levels, from education to helping connect you to, you know, other community cohorts that you may want to do some basic research using some of those samples. That's kind of a long-winded answer to your question, but does that help? Or
thank you. That's great. And we have a couple of other questions in the chat here. So I have one that says, thank you so much for discussing your work. You briefly mentioned lung cancer screening. How does that work? Also, are there any efforts to encourage patients, particularly lung cancer patients, to get their tumors analyzed for targeted therapies?
Sure. So I don't know if Grace is on the call. I know she's been working with a number of the people evaluating lung cancer screening programs. She also runs our tobacco program. So is Grace on the call, or?
Yep, she is. I just unmuted her. Yeah.
Oh, great. Do you want to answer that, Grace, or?
I can answer some of that. Currently, we have no organized lung cancer screening program at Columbia University. We've been working on that for a while, and we hope that that will come together sometime in the future. With regard to targeted therapies, however, that is beyond my scope.
So I can tell you for that part, the database shared resource, which is a part of the HICCC shared resources, they have been collecting tumor tissue for a variety of different cancers. Emer, did they also give a talk already, or
yeah, they gave a talk at the start of this, and that that YouTube is available on our YouTube channel. So I can when we can send out that information to anyone who's interested in seeing that talk as well. And of course, you can reach out to the DBSR at any point.
I also wanted to say that with regard to lung cancer screening, we do have it incorporated into our presentations that we do out in the community. I don't know if we've done this one just yet, and we encourage people to identify themselves as a heavy smoker and to know that they are at risk and to seek out lung cancer screening because it is available. We just don't have a formalized program at Columbia yet, but we do have a low-dose CAT scan machine, and it is possible to be screened with a doctor's request.
And Kim, do you want to say something about what we've been planning citywide for the first week of June?
Sure. So along with the other 5 or 6 cancer centers in New York City, we had decided months ago to plan a week of events for World No Tobacco Day and extending it into a week. So it's May 29th through June 6th. So we had been in-person events, but we decided to make everything online. So we've created a website, and basically we're asking all the sites to create short 90-second videos, and our own investigator, Daniel Giovenco, created the first one, which is just an overview of tobacco and the health effects, and then other sites copied that and recorded it in different languages. But we're also having other sites record webinars on vaping, lung cancer screening, smoking cessation, different topics in different languages. And so we're working together to release those to this website, and also through social media and through we also have a listserv for COE that has about 2,000 people on it. So we'll be working with those other cancer centers and community partners to disseminate those materials that week, and to host at least two live webinars that people can tune into to learn about. The first one is on smoking and COVID-19, and we'll have a few clinicians on there to do some short speaking parts, and then open it up for a Q&A for the community. And we'll also do another webinar in Spanish on smoking and different tobacco products. So those are some of the activities that we're doing together, and it's been a good working partnership so far. So.
Great, thank you. And I just posted the YouTube link there for anybody who wants to go and see other videos. This one will be uploaded there at some point. So if you do want to go look at the DBSR, that's there. I have some other questions. A question here: what needs of the community expressed with the COVID-19 situation based on feedback?
Yeah, that's a great question. So we actually are starting to do it's under the IRB review right now, but we are starting to do, as soon as it's back from the IRB, stakeholder interviews from the local community, both to find out issues regarding, food insecurity, issues that specifically may involve topics revolving cancer care, cancer screening, thinking also about the future, and thinking about views on vaccine hesitancy. And we are doing, after those qualitative interviews, we're planning quantitative interviews. So last year we fielded a community health needs assessment survey, and that was done through the ACN, through the HICCC cancer patients, as well as we did some in-person interviews through some of our community partners. And those data, if anyone's interested in those data, that's a very lengthy survey all about cancer screening, social determinants, also different risk factors, views on genetics, views on clinical trial research, use of alternative tobacco. So there's a lot of information in there. We're planning to field that same survey then, one year later, essentially, so we can look at how things have changed within the community. We also have been providing community fact sheets on COVID-19. I mean, there's so much information on the website, but a lot of community members don't necessarily check our website. So the COE office has created a one-pager information about COVID-19. And as I mentioned at the beginning of the call, we're hoping also then to help raise money for some of the local food banks as well. So we've done some other work with some of our community partners around the holidays as well. So we're hoping to do that now too. So look for those emails and requests to help if you can.
Great, thank you. Some of this may already been addressed, but I have I'll read out another question here and we can see if there's more to be chatted about. Great information, congratulations on how much is being, yeah.
Before I forget, because my mind, I sometimes forget too quickly. For the person who just asked that question, if they are interested, one of our community partners, and I'm attending it, it's a free online webinar tonight from 6 to 7:30. I can put in the chat the information if they are, but it's being run by WeAct, which is one of our community partners, and it's a specific open discussion about COVID-19 and how it's affecting our community. So the person who asked that question, I'm happy just to put that in the chat in case they want to tune in at 6 o'clock tonight.
Sure, that would be great. I'm sure a few people would be interested in tuning in. Thank you.
Okay.
And so, can you speak more about what the consultation services provide, especially surrounding developing an educational workshop? I think you touched on some of that already. Will you be developing some of your educational material workshops online, as you mentioned? And do you have some foresight on the receptiveness of educational workshops provided online? So some of that may already have been addressed, but
yeah, those are all great questions. So we are, and we spoke about that just the other day too, because we do a lot of pre-post analysis of these workshops. So, they go through, just like I'm sure many people on this call design your classes, right? So we go through different versions of designing these and testing them, and then doing pre-post tests to understand how well they work. And so our community partners have been reviewing the new workshops, giving feedback. As Kim mentioned, the prostate cancer workshop was really started first with focus group interest in terms of, what they wanted to see in that kind of curriculum. So yes, it is an ongoing process. And with the online, the online webinars now, we do, the poll anywhere. And I don't know, Kim or Fanish Kazan, if you guys want to speak a little bit of that, or Grace. But we are planning to evaluate those pre-post.
Yeah, for webinars that we've hosted, we've been trying different methods, but we have like a Zoom webinar account now, so we're able to collect about 10 questions worth of after the webinar or throughout. But yeah, we'll be incorporating that as we go.
And then one thing I was also going to say, because this pertains to basic science as well as all the scientists at the HICCC, one way too, if people are really interested in getting involved too, whether it's directly through their research or through doing community events or educational workshops, is the HICCC has been running a CURE program, a summer pipeline program, for the last 6 years now. And the co-director of that program, Jasmine McDonald, I don't know if she's on the call, but if she is, maybe she could speak to that, because we've had so much interest and so many great mentors from the basic science program, including Piero DeLurbo. Jasmine, are you on the call, or?
I'm here.
Oh, do
Yes.
you want to say anything about the CURE program, or?
Yeah, so the CURE program has been running for about 6 years now, and it's for those who are underrepresented in sciences, and they include high school students as well as undergraduates. And so we place them in basic science, clinical science, or population science programs. And what we do is they get a hands-on research experience within these research groups, as well as we provide them more, I would say, real world experience about how to navigate through the academy. So everything from resume development to failures are the new success. So just giving them some kind of pointers to make it through the academy. But we also provide them with understanding how to go through a literature, understanding the literature, reading different publications. And we require them to write abstracts as well as give presentations presentations. And I would say the program's been quite successful. We have one student who pretty much got a full ride to Franklin and Marshall just based off of the abstract she wrote for the CURE program that she submitted with one of her college applications. We have students that have gone on to continue working with the investigator, especially Dr. DeLerba has someone that he worked with as part of the CURE program that continues to work with him. And we have those students who have also gone on to Columbia College. So it's been a very successful program, and we're actually going to reimagine it for this summer. So we're still going to continue it. We usually require a 2-year commitment. So our students from last year will be completing their second year, and it'll be an online format. But we're still continuing the program even amidst COVID. So if you have any students or know anybody who would be interested in such a program, we'll be accepting applications for next year as well.
Thank you, Jasmine. Sorry, Emer, you had more questions. I didn't mean to interrupt.
Oh, no, that's okay. Actually, I don't see any more in the chat just now. If anybody has more, please feel free to unmute yourself or ask another question in the chat. So Mary Beth, another question, if somebody wants to gather information, is there a place to go and search? Is there a place to go and download some of the information that you put on the slides here? Is there, or is it best to reach out and chat with you guys and try to gather some information on a particular cancer, or particular incidence or mortality in our catchment area? What would be your best advice?
Sure, I can send you this particular slide deck if you want to send it around. Also, some, not all, of our workshops in English and Spanish are on the HICCC website. We'll be adding more in the future, but some of them are there so people can get an idea sort of what we've done in the past. But yeah, I mean, and in terms of any data, we're happy to, I think the easiest thing maybe is to just email us directly and say sort of what kind of data you need to see. And we can provide any of the table data that we've put in the grant. But if they had specific questions about data and needed it more granular, maybe it's easier just to email us.
Great, okay, that makes sense. Thanks. Okay, oh, good, here we, another question. Go ahead, please. Dr. Wang, did you have a question?
Oh, yeah, so sorry, I realized I just muted myself. Mary Beth and Kimberly, thank you for this talk. I know we were just emailing earlier this morning about setting up a meeting. But so I can just tell you that there's a lot of interest, at least from the radiation oncology department, to be more involved with outreach, whether it's for, the local regional population or with physicians, especially in light of the current COVID pandemic, especially a lot of fear about lack of information or over-information. So I know we're setting up a meeting to talk about trying to get more the message out to the local region. So looking forward to having that meeting with you, us, and Lisa at some point.
Great. Yeah, I'm looking forward to meeting you. I think we're going to meet next week, right, Dr. Wang?
Yeah, I think Lisa just sent out. Lisa's going to be online, but she's currently running an RTOG committee meeting right now, so I'm sort of the rep. But yeah, so I think her assistant sent an email. So.
Okay, great.
Great, thank you. Does anybody else have another question that they would like to ask? Obviously, there's availability to follow up afterwards with any of our presenters or any of the individuals at the CONE office if you have specific questions. And we will, of course, share the slides and share the video at a later point. If there are no more questions, we'll keep an eye on the chat box, and please feel free to interrupt me if you wish. In the meantime, if there's no more questions, I'll just remind everyone that we continue. I'm sorry, that's next week. We will continue tomorrow with a research in progress seminar at 4 o'clock with 2 of our members from the Cancer Population Science program, Alexander Melamed and Natalie Moza. They're assistant professors and 2 new or recent members to the Cancer Center. So please join us then for a research in progress talk. And then next week, we will continue our resources for researchers series with presentations from the Columbia Genome Center and from the Single Cell Analysis Core with Dr. Caron and Dr. Sims. In the meantime, I don't see any other questions. I think that that was a terrific session, so it remains for me to thank Mary Beth and Kim and Grace and Jasmine and everybody else who contributed, and of course everyone who contributed questions, and to wish everybody a good evening. So thank you for your time.
Great, thank you.
Thanks so much. Bye now.
Bye-bye.